Doctor, you were telling us about stereotaxic neurosurgery? Yes, that is the operative procedure that uses three-dimensional measurement. And is it for precisely locating the neurosurgical target area? That is exactly correct. If we discover acromegaly, then there may be a cerebral aneurysm. Doctor, what is a manic depressive reaction? That could be Parkinson's disease or psychogenic pain. And is there such a thing as a temporal lobe epilepsy? Yes. The stereotaxy is the use of stereotaxic instruments fixed onto the skull with screws like a scaffold. From this, a probe containing either a chemical, electrical, or cryogenic agent is introduced through a burr opening into the target area of the brain. Doctor, the surgical shunts for hydrocephalus are what? Well, ordinarily they are detour channels surgically created to relieve an accumulation of cerebrospinal fluid in the brain. And, doctor, the ventriculoatrial or ventriculocaval shunt is what? That is an insertion of the Holter or Pudens valve in order to channel the cerebrospinal fluid from the lateral ventricle to either an atrium or the superior vena cava via the jugular vein. This operation is performed for communicating hydrocephalus. And, doctor, the ventriculosternostomy is what? That is a Torkildsen operation, which is a surgical procedure for obstructive hydrocephalus. A catheter is used to shunt the fluid from a ventricle to the cisterna magna. And, doctor, what is a tractostomy? A tractostomy or tractotomy is the section of a nerve fiber tract within the brain stem for relief of intractable pain. Doctor, what is trephination? Trephination is the cutting of a circular opening or boring a hole into the skull, a method of approach to the brain. And ultrasonotomy? Ultrasonotomy is a neurological procedure in the treatment of certain psychiatric use of ultrasound, that is high-frequency sound waves. Doctor, symptomatically speaking, what is analgesia? Analgesia is the loss of normal sense of pain. And anesthesia? Anesthesia, unlike aphasia, is the loss of sensation. It may be associated with unconsciousness. Aphasia is, on the other hand, difficulty with the use or understanding of words due to lesions in association areas. What is a motor aphasia? A motor aphasia is the inability to comprehend the spoken word if auditory word centers are affected and the written word if the visual word center is involved. Doctor, the patient will not understand the spoken or written word, is that correct? Well, if there is an involvement of both centers, yes. What is ataxia? Ataxia is motor incoordination. And incoordination is the aura, well, the patient's awareness of the pending epileptic seizure. What is cerebrospinal otorrhea? Otorrhea is the escape of cerebrospinal fluid from the ear following craniocerebral trauma. It is due to a fistulous communication between the ventricular system or subarachnoid and the ear. Was it?
Not great.